Hello, how are you? A big greeting where you are and subscribe to the channel if you didn't. Today we will talk about hip dysplasia in dogs. Hip dysplasia is a relatively common disease in certain breeds that will affect the dog's hindquarters. It is due to an incongruous union between the femur and its entry into the hip, causing lameness and other related problems. Although it is a congenital pathology, there are several factors that can influence its appearance and its severity. A veterinary traumatologist can help us choose the best medical or surgical treatment. 1. What races does hip dysplasia affect? Although this pathology can occur in all dogs, it is more common in large breeds such as Saint Bernard, Newfoundland, Labrador, Rottweiler, Golden Retriever, German Shepherd. Other affected breeds can be Cocker, Shar-Pei, Breton, Bulldog. 2. Can dysplasia be prevented? As it is a genetic disorder, it is not possible to implement any preventive measure other than to avoid the reproduction of specimens that present this disorder. Hip dysplasia as such appears before 1 year of age. If it is detected later than 1 year of age, what we will see is the degenerative osteoarthritis of said dysplasia. We can worry about offering our puppy a quality diet. A diet with an excess of carbohydrates or wrongly increased dosage for a growing dog can exacerbate the problem. This can lead to overweight and consequent overload of the joints, including the hip. Puppies predisposed therefore must follow a controlled diet. Inadequate exercise in young dogs, in a phase of rapid bone growth, can trigger the symptoms. They should do moderate exercise, since both extremes, both intense and lack of exercise, can accentuate the picture. Avoid jumping to high heights or standing up on the hind legs. All these recommendations do not prevent the development of the disease, but they can delay its onset or make its course milder. 3. How is hip dysplasia diagnosed? The diagnosis will be made by history, clinical signs, general physical examination and X-rays, the latter being an essential and decisive test. To get a good diagnosis, it is necessary to sedate the animal. Depending on the severity of the dysplasia, different degrees are distinguished: mild, moderate or severe. The veterinarian on the X-rays performed can accurately measure the degree of separation of the head of the femur with the acetabulum. Being 105 degrees or more in dysplasia-free dogs. Less than this angulation would be considered dysplasia, and the severity increases as the numbering decreases. 4. Symptoms of hip dysplasia. There are several symptoms that can indicate hip dysplasia. They do not have to occur all at once. The signs that these animals can manifest are the following: hip pain, limp of the hind limb and swaying when walking, difficulty getting up, run like a rabbit, difficulty rising on the hind legs or extending them. 5. Caring for a dog with hip dysplasia. Dogs with dysplasia should exercise moderately, in a very controlled manner. This implies always wearing them on a leash and not allowing them to run or jump or play, as well as going down or climbing stairs, basically, which would be intense exercise. Lack of exercise can also aggravate the condition. If possible, physiotherapy is highly recommended, especially in the pool, as it improves muscle mass and joints without straining the hips. You also have to take care of feeding with quality products and in adequate quantities for normal and not accelerated growth. Action should be taken against being overweight, always with veterinary supervision. As we said before, it is convenient to provide your diet with substances that improve the quality and maintenance of the joints. As for supplementation, we must consult with the veterinarian, since he or she will be in charge of prescribing the most appropriate ones. Treatment for dysplasia can be both medical and surgical. For the first, anti-inflammatories can be prescribed. Regarding surgery, it is recommended in dogs in which medical treatment has not relieved pain or lameness. There are different surgical techniques that can be applied. It is essential, at this point, to put ourselves in the hands of a veterinarian specialized in traumatology. A prosthesis can also be placed. The prosthesis consists of putting steel or titanium material after cutting the femoral head so that it performs the function of the head. In many countries it is not done routinely due to its high budget. In other countries it is more developed. I hope this video helps you understand a little more. In the description of this video you have information to make your dog a happy and healthy animal. Click there. Subscribe to our channel. Take care and a hug.